Aloha, everyone. Welcome back to the negotiation table. My name is Wincy Hong, your host and the communication specialist here at HGEA. And with us today, we have Unit 13 member Kalani Moda, who is a supervisor in Child Adult Protective Services in the State Department of Human Services. Welcome to the negotiation table, Kalani.
Thank you. It's a pleasure to be here.
Thank you for joining us. Before we dive into this month's conversation, don't forget to hit the like and subscribe button so you never miss an episode. Social workers across the state provide critical support in our community to children and adults in at-risk situations. But like many departments in state government, the State Department of Human Services in general and the Child Welfare Services branch in particular are severely shorthanded. It was recently estimated that as many as 40% of CWS caseworker positions are vacant. Kalani, you are based on the Big Island in Child Adult Protective Services. Maybe we can start with you describing what it is that you and your fellow colleagues do as social workers and why your roles are so critical in our community.
We have different roles within Child Welfare Services. We have different kind of workers. We have assessment workers. We have permanency workers. That's case managers. You also have support staff, social service assistants, secretaries that do various duties within Child Welfare Services. Assessment workers are really important because they're the ones that go into the homes. When we receive a report of concern or a call of concern regarding safety of a child, the assessment workers are the ones who are assigned to go out and make contact with the family and see the kids. We have a tracking system for that, and it should be done within 48 hours. So there's some time constraints that they really have to follow. A lot of the services that they provide are very front-loaded. They'll go in if they notice any kind of discrepancies in a home. They can provide different types of services to either prevent removal or upon removing a child. There's different services that we also provide, such as drug treatment, parenting education classes, comprehensive counseling services. We have also Ohana conferencing for family planning and meeting. The permanency worker or case manager, they're assigned the case after the assessment worker goes in, and it's usually two types of legal status: family supervision. You also have foster custody, and it's their job to provide the services so the parents can get the kids back or get out of CWS to close their case if they're under family supervision. And also, they also have to do monthly check-ins with the kids. I mean, they have to see each kid every month. It's a requirement. It's actually a federal requirement. So there's a lot of things that also entail, they have to monitor each child. They have to monitor their mental health, their educational needs, and also their medical health and dental health. So there's a lot of things that they provide monthly that it's really tasking, I should say.
Recent report from the Department of Human Services stated, quote, Hawaii is currently attempting to do its work with only 63% of these vital positions filled statewide.
Mm-hmm.
Can you talk about what impact this has on the existing social workers and their caseloads?
Sure. I'm going to go back in time just a little bit. Back in 2009, Linda Lingle, who was the governor at the time, she gutted Child Welfare Services. She eliminated overnight 35 positions in my office. So the next day, 35 people did not have a job. And I was one of them, but because of my seniority and my belonging to HGA, I was able to use the bumping process to keep my job. And I'm very appreciative of the union. I didn't know what was going on at the time. It was confusing, the whole process of being using your bumping rights, and yeah, and I felt targeted, and I was targeted, but I was able to keep my job, and that's because of HGA. But Linda Lingle, she permanently eliminated 25 positions in East Hawaii. I'm just talking about East Hawaii, and that's a lot of positions. So if you get rid of that many positions, the effect is that everybody's caseload will be through the roof, and everybody will be stressed out. And a lot of people left. They couldn't maintain it. It's not sustainable. It's not sustainable at all. And so a lot of people would end up leaving, going elsewhere. Um, and we were actually able to get back 4 positions, I would say like 6 years ago. And it was crazy because we actually had to fight our own department, who was trying to kill the bill to get us the 4 position. It was crazy. But we did manage to get the bill passed with the help of HGA and a lot of community support at the time. But when you get that much work and that much stress, you get burnout, and burnout is real. A lot of people leave. I don't want to speak negatively about the other positions throughout the state, but why would you want to remain at CWS if you could get the same pay at the DOE or the Department of Health and have less stress and have less of a workload? It's created kind of a vicious cycle where a lot of workers, I don't know how they stay. Like, I stayed for 30 years, 32 years, but I know a lot of workers, when they first come in the door and they see the amount of stress and caseloads that they have, and they end up leaving.
The standard for caseload set by the Child Welfare League of America is 6 to 8 cases per worker, but Hawaii social workers can have as many as 54 cases. Our members, I'm sure, are working around the clock to keep up with that volume of work. What personal sacrifices do you hear your colleagues making? Are there lots of nights and weekends, giving up breaks and lunches?
Oh yeah, guarantee. People are working late, so because the work is endless, and they're spending less time with their families. They're not eating healthy. They're eating on the go, and they're eating whatever they can get as you're driving to see other kids or other cases. You're eating in the car a lot of times. And on the Big Island, and especially East Hawaii, we're responsible for a very, very large area. And you can spend hours driving around. Yeah, and if you have 28 to 32 kids on your caseload, and you have 20 working days a month, you gotta see a lot of kids. You'll be on the run a lot. I would say East Hawaii, our average caseloads right now are between 16 and 21 cases per worker, with approximately 28 to 34 kids per person, per worker. So that's for like case managers. Assessment workers, we only have one assessment worker right now. And she's really busy. But because of that, everybody else, including supervisors, are doing assessments, including me. And case managers who don't normally do assessments are doing assessments. So it's double, triple duty right now. So that's in East Hawaii on the Big Island. And we know there's shortages right now in Kona, on Maui, and in East Honolulu. So those are the places where the workers are doing a lot more than they usually do. A lot more. Kona has a 50+% East Hawaii has like a 40% um, vacancy rate. Maui has probably a close to 60% vacancy rate, and East Honolulu has um, uh, close to 60% vacancy rates right now. So those are the areas that I guess the department targeted for the shortage differentials. And so if you're a brand new worker going there, especially as an assessment worker, you will get the shortage at the highest amount. And that's why some of them are making more than their section administrators.
Despite those challenges, the department recently reported a drop in children in foster care, the lowest in a decade. Obviously, HGA members like you are making strides even while facing staffing shortages. Can you talk about how you are doing more with less?
Yeah, and I have to speak to there's some initiatives that the department has taken on, and it's regarding prevention of placement. Family First is really impacting, I think, the amount of kids coming into foster care. And if you can avoid that, that's actually the best thing to do. Needless placements is really over the, I would say, like the last 10 years, it has gone down a lot. So we are doing more with less. There's in-home based services. There's different services that you can provide the family that where you wouldn't need court involvement or foster placements. I think it's helped to, in a lot of ways, to reduce the amount of cases totally, but there's still a lot of cases though.
Let's pivot to recruitment. A few years ago, the state legislature passed a set of bills, including a boost in pay, meant to help recruit social workers. Governor David Ige vetoed the bill, but obviously lawmakers are aware of this problem. What's the biggest barrier, in your opinion, to recruiting social workers to join the ranks of government?
I would say the caseload. Like, again, why would you come to work for child welfare services when you can go to other departments and get the exact same pay and do way less? And the amount of stress that workers are enduring and having to go through is probably one of the biggest reasons for leaving right now, why they are not remaining with child welfare services. So while I mean those bills are great, I don't know if money replaces time. There's got to be some kind of balance, and I think that you can get paid a lot more money, but then you're not spending too much time with your families, and you're always putting in a lot of overtime. I would say on average, like assessment workers a week is like 15 hours of overtime. Yeah, kind of on average. Talking with different assessment workers around the state, and so that takes away from their families, takes away from, a lot of things, and just adds more to the pile of stress that they already have. Because this is like, nobody really wants child welfare services in their home. Nobody will like, oh yeah, come in. No, it doesn't happen. And people are like a lot of the cases where they're involved with drugs or and domestic violence. So we have some really, really tough situations with these families, and they're not welcoming at all, most of them. And so, when you get those types of situations, it's hard to stay in child welfare services when you can go elsewhere. I've lost workers to Hawaii Health System. The next day when they started work at the Hawaii Health System, they got promoted, like the STEP movement plan, they started at step L. So they went from step C or D, brand new workers, to step L. So they're making $2,000 more a month. Yeah, so they're making that much more money a month, and the level of stress is way low. So we lost workers to them. They also have the we lost a few SSAs, social service assistants, and you're only as good as your support staff. So we lost a few of them because they have what's called an SSA 5 that doesn't exist in CWS at all. It's hard to overcome when you're getting paid way more and you're doing way less. And the stress levels, and you get to see your family at the end of the day. Like at 4:30, you should be going home at 4:30. A lot of CWS workers don't go home at 4:30. Hiring workers in Kona, Maui, and East Honolulu. I think it's housing. I think it's so expensive to live there that it doesn't equate really to live and work there, and where housing is to the roof in those areas. Maui, Kona especially, it's a tourist town, and they've traditionally had a hard time recruiting and retaining workers there. I know the federal government has COLA, or even like housing allowances for the military. I don't know why. Maybe some of those places could use COLA or housing supports.
When you talk with other social workers in your field, do you hear comparisons between working for government versus the private sector? Is there a way the state can position itself to be more competitive with private organizations?
Yeah, I think eventually, yeah. I think they'll be in a better place to do better recruitment and retention. Right now, it's kind of hard, but I think in the future they should be able to do that. But I think one area where it's really lacking is for the support staff. The social service assistants, they get paid less. A lot of them get paid less than where they came from. Like, I have a worker who came from, he worked for a grocery store. He made more there. Yeah. And he just wanted to do something in his degree to kind of, and maybe potentially move up at some point. The problem with that is that there's no real connection from being a social service assistant to the social work series. Even if you have a degree, you need to have at least 6 months to a year in case management experience. Unless you have a degree in social work, then you could apply. I think if they had like a social worker one position, or maybe they had other positions like where they could TA into the position. I was an SSA. I started as an SSA, and a lot of people quit, and I had the opportunity to TA. So chaos is a ladder. Yeah, it is a ladder, and I was able to become a social worker because of that. But and I made a career out of it. I was before that I was pigeonholed. You're stuck. You couldn't get that additional case management experience as an SSA.
The state's cumbersome hiring process has been a complaint of the unions for years. The slow vetting and processing of applicants that doesn't seem to keep up with the number of vacancies. What reforms would you suggest to get social workers in the door quicker?
I've heard that it takes from when the position is posted to actually getting a worker in the door, it's 6 months. That's what I'm hearing, between 5 and 6 months. And that worker, once they're in the door, can't get any active cases until they completed the training process. So it's like a year before they can actually take cases. Yeah. So that's a long time, and it should be quicker. I know they started like the wiki hire process, and it should have been quick. It should make the interviewing process and the hiring process quicker. But compared to private sector, it's like super slow. And right now we're just not getting applicants, not everywhere. By creating different positions, even so that if those vacant positions can be filled by TAing. Also, that way you can get somebody in there in the position while you're recruiting at the same time. I really don't know what the answer is to speed up the whole process, but I've been in state government. I'm just used to everything taking a long time.
All right, Kalani, it's been great hearing your perspective, and I'm sure your fellow social workers appreciate your voice. Are there any final thoughts you would like to share?
Despite the negative circumstances we have now, I'm really optimistic that at some point uh, we'll be able to right the ship, so to speak, and um, and do better as far as worker retention and recruitment. I think it's cyclical, and I've seen the pendulum swing many, 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 many times, being there for 30 plus years. But I'm still optimistic that things will improve and that they'll be able to hire workers and keep the workers.
Well, mahalo again. We appreciate you taking time to fly to Oahu to join us today. Thank you so much.
Oh, no problem. I had a great time.
Join the conversation, everyone. In the comments, let us know if you yourself are a social worker. What personal sacrifices are you making to keep up with your caseloads? Do you have any ideas on how to recruit and retain social workers? And we can't wait to see you back here next month at the negotiation table. Bye for now.